Question 2. What are normative reactions after someone has been exposed to a disaster?
Normative reactions are those that make sense after someone has been exposed to a horrific, life-altering event and that do not suggest that the individual is at risk of developing lasting problems as a result of their experience.
Reactions are often grouped into different areas, the most common being emotional, cognitive, behavioral, and physical. Spiritual is also now included more frequently.
The physical involves palpitations, breathlessness, jumpiness or edginess, rapid and shallow breathing, indigestion, nausea, diarrhea, constipation, muscle tension or pain, fatigue, headaches, sleep disruption, changes in body temperature.
The behavioral involved dietary changes, eating less, eating more, eating less healthy foods that can perpetuate the stress response. Social withdrawal and isolation, perhaps to deal with hyperarousal symptoms of irritability and global overstimulation. Purposeful avoidance of reminders of the disaster and/or purposeful immersion in reminders and activities around the disaster. Increases in the use of alcohol and mood-altering substances which can be seen as ways of self-medicating and providing immediate relief from internally disturbing thoughts and feelings. Increased feelings of dependency on others and neediness. A desire to over-control relationships. Changes in sex drive.
The emotional response include distress, tearfulness, emotionality, anxiety, depression, impatience, irritability, anger, hostility, rage, vulnerability, feeling rushed, panic.
The cognitive or thinking involved worry, or rumination, preoccupation, difficulties in concentration, forgetfulness and making uncharacteristic mistakes.
The spiritual reactions that are usually noted reflect efforts to make sense of what happened. Those impacted by disaster tend to search for an answer to why one person's life can so swiftly be torn asunder, and why another's experience is entirely different.
Question 3. Describe the stages of a disaster reaction.
Disasters can be seen as events that have a beginning, middle, and end. Other stages include the heroic phase, the honeymoon phase, the disillusionment phase, and the reconstruction phase.
Question 4. The impact phase. The impact phase is one of the most crucial stages.
Magnified arousal levels characterize impact phase reactions and responses. This increase in overall arousal sets the stage for traumatic imprinting. The primitive fight-or-flight response is activated as the body readies for action, even if one is not at the core of impact. Less frequently a freezing response occurs. This freezing, or peri-traumatic dissociation, has been connected to poorer past disaster functioning.
Certain typical behaviors are frequently seen during the impact phase. Survivors who believe they are facing possible death may assume a protective posture, such as hiding under an object or curling up into a ball, and they may make efforts to hold on to and shield others.
Contrary to stereotype, panic has not been documented as a prevalent response during the impact phase. Purposeful and more productive acts are far more common.
Question 5. The period following a disaster can be further divided into a series of stages. The heroic phase, the honeymoon phase, the disillusionment phase, and the reconstruction phase.
Question 6. The heroic phase. The heroic phase, which occurs during and just after the disaster's impact, reflects survivors' immediate outpouring of amazing and noble efforts to help those most devastated.
Question 7. The honeymoon phase. The honeymoon phase is a collective spirit of mutually reinforcing compassion and a striving to provide relief. At this time, those involved in the disaster, as well as those observing it, are focused and like-minded, sharing a sense of purpose. Social barriers are not as pronounced, so people start to feel closer to each other, unified by a common mission.
Question 8. The disillusionment phase. There comes a time when the community must readjust to its changed circumstances. So after the initial energy Excitement and hope that characterize the honeymoon phase starts to decline and the disillusionment phase may set in. This is the reflective sequel that feels anticlimactic after months of community activity and passionate intensity.
Question 9. The reconstructive phase. The reconstructive phase can last several years and perhaps the rest of a person's and community's life. The task required in this phase can be quite profound. Extreme destruction is followed by extreme challenges to rebuilding and reintegration.
The concept of a sequence of post-disaster stages is useful because it reflects the reality that responses to disaster usually follow a progression, characterized by decreasing intensity and arousal as time passes. Yet disaster's impact remains, especially in events of significant scale and intensity.
Question 10. Define grief, normal loss, traumatic loss, traumatic grief, death imprints, new normal.
Grief is the emotional reaction to loss.
Normal loss describes the death of a loved one in circumstances that allow for some preparation for or expectation of that death, and it involves the achievement of a return to full functionality after a period of mourning.
Traumatic loss describes the death of a loved one suddenly. Often horrific, violent circumstances that reflect and intensify the experience of trauma. Traumatic loss is often compounded and made more complex by a shared, communal context, as in disasters.
Traumatic grief is the process of dealing with traumatic loss. It is sometimes called traumatic bereavement.
The death imprint is exposure to loss involving death, an experience that leaves the survivor spellbound by images that seem indelible and feel disturbing.
New normal. The aim is to review the loss, come to terms with the changes and integrate oneself into a new active meaning reconstruction in response to loss.